Well, good morning and welcome to South Australia's daily COVID-19 update. Today I'm joined by Professor Nicholas Spurrier, Deputy Commissioner Linda Williams, who's also the State Coordinator during this major emergency declaration, while Commissioner Grant Stevens is on leave, and of course Stephen Wade, the Minister for Health and Wellbeing. We've just finished the National Cabinet meeting. This was the meeting which was brought forward. It was due to occur on the 5th of February and brought forward to today, and the Prime Minister has made it clear that we will now meet fortnightly or more often as required. Today we reviewed the situation with regards to the coronavirus, and in particular the effects of the new UK strain occurring right around the world. And our thoughts at the moment are with people living in those countries who are now severely impacted by that UK strain. It is significantly more virulent, 50 to 70% more transmissible than the original strain. And we've seen in the UK more than 1,000 people die each of the last 2 or 3 days. And so our thoughts are with those people who are really struggling to bring the coronavirus under control in those jurisdictions. And that's exactly and precisely why we've taken decisive action today from the National Cabinet to make sure that we can minimise the risk of the UK strain having a significant impact here in Australia. So a couple of issues that were decided. I'm very pleased to announce that our suggestion from South Australia that pre-flight testing come into place has been agreed to, and the federal government will make it clear how that rollout will occur in the coming days. But our suggestion for pre-flight testing has now been adopted by the National Cabinet. Secondly, we have now adopted a new national standard with regards to the wearing of masks on international and domestic flights. This previously was on advice. People should wear them. It is now people must wear them on all domestic and international flights. And then also we made a decision within National Cabinet today that we would not be increasing the overall number of international repatriation flights that we have coming in. There was some pressure for states to increase their room caps, but South Australia will be remaining exactly where we have, which is at a diminished level from where we were several weeks ago prior to the Parafield cluster. As you would be aware, there is a significant issue in Brisbane at the moment, and Premier Palaszczuk has made it clear that the Greater Brisbane area will have a lockdown from 6 p.m. tonight until 6 p.m. on Monday night. This will be for Brisbane, Redland, Ipswich, Moreton Bay, and also Logan. So Brisbane, with those other areas included, will be on a lockdown from 6 o'clock tonight through till 6 o'clock on Monday. Premier Palaszczuk has asked all other states to declare those areas as a hotspot, and we have agreed to that on a national basis. So people won't be moving in or out of those areas as of 6 o'clock tonight. We will put our direction in place so that as of midnight tonight, anybody coming in from that area will be required to do a 14-day quarantine. But as I said, people are not going to be moving in or out of those areas as of 6 o'clock tonight. It is important to also note that with regards to this case that has come to light in Brisbane, one of the hotel quarantine workers, this person has used public transport and has done shopping. A net is being put over all of the close contacts of that person at the moment. But we need to be very clear about, in South Australia, anybody who has been in the Greater Brisbane area will receive an SMS message from SA Health Today requiring them to go and get themselves tested. Anybody who has been in the Greater Brisbane area since the 2nd of January will be required to have testing here in South Australia, and those people will be advised via SMS later today. We will clearly be looking very closely at this case over the next 3 days. We expect the testing in Queensland will significantly increase, and we'll be looking very carefully at that. And if we need to take any further action with regards to border restrictions with Queensland, then we will have no hesitation in calling a press conference and doing that immediately. Finally, today we discussed at length the issues with regards to the vaccine rollout in South Australia. We do want to have a fast-track TGA approval for the vaccine that we use. We will start using the Pfizer vaccine, which will receive its registration in very likely later this month for immediate use in February. Around the middle of February, we will start with some of those high-risk groups. The AstraZeneca vaccine is undergoing its registration at the moment. It's more likely that that will be available for more broad population use from March onwards. There are still many questions with regards to the exact logistics for the vaccine rollout, but what I can say is that all states are working with the Commonwealth to make sure that we can roll out this vaccine as quickly and as efficiently as possible, but it will be done in a prioritised, risk-based way. And I would like to acknowledge and thank SA Health for the work that they've already been doing on the vaccine rollout since last year. I met with Professor Spurrier and Minister Wade yesterday to get an update on the excellent work that has already occurred in South Australia, so that when that vaccine gets its registration and it arrives in South Australia, that we can hit the ground running and make sure that we can have a very effective rollout. I'm now going to pass over to Professor Nicola Spurrier, who will give the daily update in terms of the number of tests, any new infections, and then Deputy Commissioner Linda Williams will be available. I'll be available to take any questions that you may have. Thank you.
Thank you. So we are in a good situation still here in South Australia, and we want to remain in that situation. We do have some new cases though, but these are all in our Medi hotels. So 3 new cases, a man in his 40s, man in his 60s, and a woman in her 30s. All of these cases, as I've said, have returned from overseas. But the other thing just to note, and also having that very worrying news from Queensland about that UK variant, we have had some genomics back, and people may be aware that every single case in South Australia we have genomics run on. So we do know that in fact we've got another 2 cases with that UK variant here in South Australia in our Medi hotels. Now, one of those might prove to be an old case, and we're doing some further testing. But I want South Australians to understand that whilst there is that issue, which is very concerning, because of course we've got somebody who's been out in the Queensland community with that particular variant, we do actually have that variant here in our own state, and we have to be very mindful of that, and we have to not have complacency. We've all got to be still doing hygiene, the physical distancing, the QR scans and all of those sorts of things, and getting tested the day that you get any symptoms. So we still have to be very aware here in South Australia. So this takes us to 585 total cases and 12 active cases in our state. We have very high testing rates. We've got over 5,400 tests conducted yesterday. Now, part of that is because we require testing from anybody that is allowed to come back from New South Wales. And as people know, there is that border in place, and we still have returning residents and those who are relocating, and there are some exemptions being given for particular people who are coming from New South Wales. But all of those people require day 1, 5 and 12 testing. But however, I am hopeful that some of those tests, that large number of tests done, are South Australians thinking about protecting themselves and their community, and if you have any symptoms at all, making sure that you get a test on the day that you have symptoms. So I'll just reiterate our advice about things in Queensland. It is absolutely important for every South Australian to reconsider any travel plans that they may have with Queensland. And although the lockdown up in Greater Brisbane is for those 3 days and it's a circuit breaker, it's very similar to what we did with the Parafield cluster. Things can change quickly, and we'll be monitoring the situation very, very closely here. And I will be talking to my counterpart, obviously, up in Queensland on a regular basis. So from today, anybody that comes from Greater Brisbane area into our state today will require day 1, day 5 and day 12 testing. They're not required to isolate, but they need to have that testing. And to facilitate this, we've already made plans to stand up additional testing at the Adelaide Airport. We did have a testing facility there, but we have sent out people to boost that because we want to make sure everybody that's coming on a flight gets tested. And I hope it's not inconvenient for people, and we'll try and do that as quickly as we can when people come off those flights. However, as the Premier said, this person, unfortunately, this person who worked in the Medi Hotel has been infectious in the community up in that Greater Brisbane area from the 2nd of January. So we will be SMSing anybody that has travelled from that area to go and get a test as well. And we will require a test as soon as possible and then a test 5 days later. As the Premier said, from tonight, from midnight tonight, we will be allowing people to come back into our state, but all of those people will require quarantining. And obviously, with a shutdown order, a lockdown order in the Greater Brisbane area, we would be expecting that there will be no people who are Brisbane residents getting on planes and going travelling, because that won't be a reason to leave the home. But there's obviously some residents, South Australian residents up in Queensland, that may wish to come back. So that's where I've got to with this particular update. But I do just want to alert people to the fact that whilst Victoria has been doing very well, you know, they had seeding from the Avalon cluster, I'm still watching that situation very closely, and we're obviously still monitoring the situation in New South Wales. So South Australians have always done a fantastic job with COVID last year and this year. Please keep doing the same. Keep looking at our website. Keep checking the other states' websites as well if that is pertinent to you. Get testing if you get symptoms. The day you get symptoms, you've got to keep washing your hands, 1.5 metres, physical distancing, and you know, we will all get through this together. And I was very pleased to hear the Premier talking about some of the other things that we're doing in terms of international arrivals. I'm very pleased to hear that we will have masks mandated on our domestic flights. All of these things are layering up how we can protect ourselves and our community. So I'm very happy to take questions or to pass over to the Assistant Commissioner.
What about people who are coming back before midnight tonight?
So those people will require testing, and as I said, we will have testing facilities at the airport, and they'll require day 1, 5 and 12 testing.
And what about, do they need to stay home? What's the direction there?
No, so those people do not need to quarantine. We felt we needed to give people an opportunity to make a decision before getting on a flight. We don't want to have people mid-air turning up in South Australia and then having to go into quarantine. So it gives people a little bit of time to plan, but definitely from midnight everybody will need to quarantine.
Is there any further advice regarding New South Wales as well? There are more cases there of locally acquired COVID-19. Any further advice?
No, so we'll be keeping our restrictions in place in terms of the current direction. We are allowing South Australian residents one opportunity to come back, and many of those people have come back already. There are occasionally people who are relocating here, and we allow that to occur as well. And there's various exemptions for health and freight and such like. Just to make sure that we can continue working both sides of the state.
And just in terms of the UK strains that we have here in South Australia, can you just clarify the number of total cases that we have of that here now?
Yeah, so we have had 4 cases of the UK variant here. 2 of those people have been cleared and have been released from isolation. Those 2 people also required hospitalisation here in South Australia, and we've had another 2 confirmed, one which may be an old case. But I just wanted to reiterate to people that whilst obviously there's that risk in Queensland, we still have that risk here in South Australia. And so we are doing absolutely everything we possibly can from a hotel quarantine perspective to make sure that our staff are safe. And I'm very pleased that we've started daily saliva testing on our staff in the Medi hotels today. They will still require a 7-day throat swab and the PCR testing from the throat and nose swab, but the saliva testing will be doing every shift on all of those workers. And the reason is that all of this layers up. So we know that the throat swab is more sensitive, it's more reliable, but if you're doing a test every day, that can improve that sensitivity. So we will be combining that for our staff.
And in terms of those that have been found to have that UK strain, what happens to them once they're sort of diagnosed to have that? Are they moved off into a separate area, or
so
how
we
is that
do,
managed?
yeah. So we do have our dedicated Medi hotel just for cases. So they are treated in the same way, and they are part of that facility. So we have to treat every returning traveller as though they have COVID-19, because that's the way we need to keep our staff up to speed with all of their PPE and the like. But for example, with the 2 cases that had been admitted to the Royal Adelaide Hospital, I also requested that all the staff at the hospital also have regular surveillance testing as another precautionary feature because of this particular variant.
What's your advice for people that might be planning on boarding a flight to Queensland today?
Well, of course, it depends why they're going to Queensland. So they might be returning residents to Queensland, and of course, you just want to get back home, and there's no problems with that at all. But I do think South Australians need to rethink their travel plans, and I happen to be in the unfortunate situation of having to rethink my own travel plans. So, you know, it happens to all of us. We want to take a holiday, we have things in place, but the virus doesn't care. We're in the middle of a pandemic, it's pretty inconvenient, but we've just got to do what we have to do.
At what point would you be considering requiring people to quarantine when they come back into the state? What's the threshold for changing those guidelines?
So people will, from midnight tonight, coming from the Greater Brisbane, need to quarantine coming into South Australia. We'll keep watching the situation. We are going to use that hotspot model, at least for the time being, but if anything changes, it may be that anybody returning from anywhere in Queensland has to quarantine here, and if things do get worse, it may be that we have to reduce the number of people coming into our state.
And you touched on as well with Adelaide Airport putting in more staff for the testing clinic. Just how much has that been bolstered?
So we've done that this morning, so I can't give you the details on that.
Just with the UK strain, but you know, how concerned are you about that now being in SA, considering it is more contagious?
Absolutely. This is one thing that makes me really concerned. We know there's very good information that it is more transmissible, about 50% more transmissible. And the other thing is, and we're gaining more information about it, is that the way we deal with this virus may not be the way we currently deal with this particular virus if we had outbreaks, may not be hard enough for this particular strain. So it is absolutely imperative we do everything we possibly can to make sure this doesn't leak into our community.
Are you concerned at all about the large numbers of people that might be coming back to South Australia today before midnight that won't have to quarantine?
Look, everything is a risk, and we have to weigh up these sorts of risks. So we would be certainly saying to people, if they had been to any of the particular locations that have been on the Queensland website, that we would require those people to quarantine, because indeed that's what is being required in Queensland already. And I know the team in Queensland will have been doing a fantastic job with their contact tracing. They will be supercharging it the way we did here with the Parafield cluster. So I think it would be unlikely that we have anybody that's a close contact be on a flight coming to our state today, but we also, on the other hand, have to give people enough warning, and we don't want people who are mid-flight to suddenly realise that they're coming into South Australia and they're going to have to quarantine. So we are giving them that small window up until midnight tonight.
Just confirming that case with the UK strain, it's entered into SA through someone who's travelled from the UK?
I just don't have the complete details about that, I'm sorry, but we do know that that UK strain, that variant, is also in other countries, and so it's a good question, but I just don't have those details.
Can we just clarify as well that the new direction, does that apply at all to the Gold Coast or any other areas?
No, it's the Greater Brisbane, and the Premier went through the suburbs that were included.
Do you know how many South Australians are in Queensland at the moment?
No, I don't have that information. The Assistant Police Commissioner might have that.
I'm happy to go through those areas again. So it's Brisbane, Logan, Ipswich, Redland and Moreton Bay. So that is the area that Premier Palaszczuk has identified as the hotspot, and it's the one that National Cabinet has adopted.
I don't know if this is one, sorry for Mrs. Spurrier, but what are you going to be doing in the way of ramping up procedures and protocols in the hotels, considering it is so much more contagious?
Thanks for that question. What I can say is since the parafield cluster, I think we have done absolutely everything possible we can do for a hotel quarantine to make it safe. Now, the problem with having quarantine in a hotel is that it is inherently risky because you've got lots of people and you've got people in rooms and you've got corridors and such like. So we have done the best that we can possibly do. We've looked at it from all different angles and we've got expert advice from outside our state. We've looked at the Victorian report and we've tried to implement all of those things. At the end of the day, it's not a hospital. It doesn't have the same ventilation. It doesn't have the same, training and PPE for staff. But we have tried to do everything possible. So, hand on heart, I could say that this is the safest we can possibly be. I am really happy that we're doing the daily saliva testing because, again, we're layering these things up.
Premier, on another matter. Tennis Australia has announced that we're going to be having an exciting exhibition tournament here with some high-profile players. How much of a win is that for South Australia?
Yeah, look, it's a massive win for South Australia. We've been working very closely with Tennis Australia. We'll have some of the top seeds who will be playing at the Australian Open right here for a day at the Drive on January 29th. And I think this will be a very special day for South Australia, and I think in many ways will showcase just how well South Australia has done with the coronavirus to be able to have a match with the top seeds in the world here in Adelaide playing in front of an audience.
Why are they coming here to Adelaide?
Well, we have been working with Tennis Australia and SA Health and SA Police to be able to bring in a very small number of the top seeds to play a lead-up match at the Memorial Drive on the 29th of January. So I think most South Australians will be very excited about the opportunity to see these incredible stars right up close and personal.
What will be their quarantine requirements to ensure that they are safe and keeping everyone else safe here as well?
Well, we have looked at this extraordinarily carefully, like we do with any person coming into Australia, and that has been overseen by SA Health, who have looked through every opportunity to make sure that we can bring them in, but do it in a way which is very, very safe for us here in Adelaide.
So they will be required to do 14 days quarantine?
Oh yes, there's no, even though these players are the top seeds in the world, they will still have to abide by the very strict 14-day quarantine, and every aspect of what they do, right down to going and having a hit up, is being very, very closely monitored, not only by SA Health but also SA Police.
Do we have any players confirmed yet? Any names?
I don't have those with me at the moment, but what I do know is that Tennis Australia has been working very closely with us. I think every South Australian was very upset when they heard that the Adelaide International, which was such a fantastic event last year, couldn't be held this year. And so this is something that we've been able to negotiate with Tennis Australia. Further details will be made available in the coming days.
What about exemptions just in general? What about exemptions just in general in regards to the 14 days quarantine and people coming in from Queensland?
I don't think I'm not quite sure exactly what your question is,
will there
whether
be
there's any other
exemptions?
changes.
Will there be any exemptions? How are you going to approach
Oh,
exemptions?
sorry, I get what you're talking about now. Look, we do have an exemptions process in South Australia because from time to time there might be an end-of-life arrangement or an issue like that. So SA Health and SA Police look at every single one of those on their merits. When we can accommodate them without unnecessarily increasing the risk, well, of course, that's exactly and precisely what we want to do. flu. But the exemptions process, which exists currently for New South Wales, will now apply to the greater Brisbane area. But at this stage, we don't have further restrictions for the other parts of Queensland. But as Professor Spurrier said, I think everybody needs to be alert. We're going to be looking at this particular infection in the Brisbane area very carefully over the coming days. Premier Palaszczuk has acted very decisively, a 3-day lockdown, very similar to what was put in place with the Parafield cluster in South Australia. I think most people now appreciate going hard and going early and then getting back to a sense of normality as quickly as possible is really the benchmark for how we should be dealing with these infections going forward.
Did National Cabinet come to any resolution on testing hotel quarantine workers every day, or is that just an SA initiative at this point?
No, that's a National Cabinet. Now, look, individual states will move to it at their own pace, but as Professor Spurrier has said, look, since the Parafield cluster, we've looked at every single aspect of the way that we operate our hotel quarantine arrangements. And in this instance, as of today, we're starting the daily testing of those workers. We want to look at every possible vector of risk, and we want to eliminate or at least mitigate against as much as we can.
You mentioned about the masks being mandatory on flights. What was the discussion around testing people before they get on flights for COVID?
So the Prime Minister will be standing up very shortly, I think, and be going through that. So there are still some logistical issues with regards to the pre-flight testing. We know that we already are doing pre-flight testing for passengers travelling back to their own countries here in Adelaide. We've got to provide certification. We're going to require that from overseas, but the exact detail is still yet to be determined. But this was a critical part of our 8-point plan in South Australia. I'm very pleased that my colleagues around the National Cabinet have agreed. This has been also now endorsed by the AHPPC.
Any other questions for anyone else? Quickly. Yeah, just obviously in relation to the border, is there a bolstering of your officers that will be both at the airports as well as on border checkpoints as well?
Yeah, so we've determined to increase our border checkpoints, particularly at the southeast. We're increasing and opening up 6 border checkpoints, and we'll open the border checkpoint at Marla and Maree because we know that people will transit through those routes returning to South Australia. This will enhance our ability to give people information about their situation and their need to quarantine if they've been in the Greater Brisbane area, and it will also allow us to be able to track people's movements in and out of the state should it be required at a further point.
When will that come into effect? Is that sort of happening now? Or
my team in SAPOL are working on that as we speak, and we're hoping to have that up and running as soon as possible. Clearly we have to get people to those checkpoints, and we have to put the infrastructure back in place, which is nearby to those sites. We didn't bring it back to Adelaide, so as soon as we can.
in terms of airports as well? Any sort of further?
No, there's a significant number at the airport. I think we're quite comfortable, but we'll monitor that as we go forward.
How often will you be checking up on people who are meant to be in their 14 days quarantine?
We'll take the advice from Health. It's a risk-based assessment, and as we currently do, compliance checks will be conducted on a needs basis.
Have there been any breaches of compliance checks in recent days from those heading in from or coming in from New South Wales? Anything?
No, they haven't. People are taking a very common sense approach. People are very compliant. I think they take their own social obligations very seriously. So we're very pleased with the level of response that we've been seeing.
Are you able to tell us how many South Australians are in Queensland?
I would have no way of gauging that, but I think you could take a practical viewpoint that it's school holidays and there would be a number of people who would have travelled there for the school holidays, let alone any other private business.
Thanks,
Thank you very much.